Hello, viewers. Welcome back to Vibing with Mr. Marvelous. Today we have our no other than a dentist today. Not just a dentist, we have Dr. Herman. Dr. Herman, welcome to the show.
Thank you for having me today.
Fantastic. So before we go into Dr. Herman and find out what he does and a little bit about him, our trivia question for today will be dental related. Hint, hint. We have two parts to the question. So, how often should you brush your teeth daily? And what's the best time to floss? Before or after you brush your teeth? So, two parts to the question. So, how many times should you brush your teeth daily? And should you floss? Yes, those strings or non strings, there's all kinds of floss nowadays. Before or after you brush your teeth? All right. Dr. Herman, give them 5 minutes to get the answers correct. And in the meantime, who are you? A little bit about yourself.
Absolutely. So, as Mr. Prince said, I'm Dr. Lyle Herman. I am a third generation dentist. My grandfather, then my dad, then me. And it actually extends further out than that. Both my dad's brothers are general dentists in the state of Florida. My stepmom also is a children's dentist in the state of Florida. My stepmom's brother. So I come from a dental family.
Wow.
Oh my gosh, yeah. Somehow I ended up in the dentistry field too. I've been around it my whole life, so I love it. So I went to dental school in Cleveland, Ohio. I went to Case Western Reserve University. And since I graduated 2012, I've been at this location here in Wellington, and that's where we are today.
Fantastic. So many generations. Well, as a child, were you, because of your environment, you wanted to become a dentist, or it was something that you wanted to do?
A little bit of everything. It's funny. I remember growing up from a really young age. My grandfather had I guess, would you say, a dental empire in the New York, New Jersey area, and I grew up family dinners, and everyone would be talking these terminologies and patients this and patients that, and I'd be like, what are they saying? And it was like a different terminology, different language. And I was like, I want to know about this. And I remember vividly my grandfather saying, well, like, how do you make money? And he's like, oh, well, I take their teeth and I go to the bank and I get money. I'm like, oh my God, I want to do that type of thing. And ever since then, I've just been around it, always tried to get involved, get into the office and get my hands dirty, if you will. And I just fell in love with it. And I remember my grandfather always used to say, Lyle, please find something different. Go into medicine. Go into something different. And I always just kind of gravitated to dentistry, just being around it. It was completely my own choice. As far back as I can remember in school, in elementary school and middle school, teachers would always be like, what do you want to do? And I'd be like, I want to be a dentist. They'd be like, you want to have your hands in people's mouths? I'm like, yeah, I do. So it's just something I fell into. I've always saw myself as being a dentist. I always envisioned myself as being a dentist, and honestly, it's the greatest thing I ever could have done. I love what I do, and I have no complaints.
Fantastic. And it's funny. There's a saying: "What we surround ourselves with, or what we
Absolutely.
do from young, it becomes part of us." It's
absolutely 100%.
At the end of the day, not all the time, but 90% of the time, what we surround yourself with, you become that thing.
100%. I've been around it my whole life. And, even my aunt, who's my dad's brother, she's a hygienist. My grandmother worked in the dental office. So, in some way, shape, or form, from all aspects, it was just ingrained in my head. And again, it was all my choice, but it was just something I enjoyed. I felt I liked the clinical nature. Today, medicine, you go to the doctor and they give you a little piece of paper. You go to the pharmacy and they give you a pill. Dentistry is very different. I have to I'm the x-ray radiographer. I'm the clinician. I'm the surgeon. I have to be the one to give you the bad news. I have to be the one to give the good news. I'm the educator. So I feel like I'm very well-rounded, and I just enjoy also working with my hands, making a difference in this case, children's lives. It makes for a very fruitful and rewarding career.
I'm happy you shared that, because most people think of, when you go to doctors, one person does this, one person does this, but you wear many hats as a dentist.
Absolutely. Obviously, my team is extremely important.
Absolutely.
But you go to the hospital, you see this one doctor, and then they send you this doctor, another this doctor. I'm the guy here. I have to do everything. So, and growing up always drove me nuts. Oh, you're the dentist. No, you're a fake doctor. Last time you had a toothache, you tell me.
I've heard that before. Dentists are not real doctors.
Drives me crazy. Not only are we not real doctors, a medical doctor has 4 years of medical school. Dental school is also 4 years. For the first 2 years, we do identical things. We have the same sciences we're taking. We have the same what we call cadaver lab.
Right.
We dissect dead bodies. The same exact thing the medical students do. The only difference is where you're 3 and 4, they go to the hospital and start rounding in the different departments. We basically become student doctors and start getting involved. So we're trained in anything from obviously dental to emergency medicine,
Yes.
if you will, to basic first aid, to CPR, basic life support. Also learning about pathology, different diseases of the body. Believe it or not, we have to learn about diabetes in detail, cancer in detail. So it's not just the mouth.
Teeth, right.
It's not just that. And you go to the emergency room, and we have a lot of patients that do for certain things, and it drives me crazy. They go to the emergency room, and you talk to an emergency room doctor, and they go, they have no idea about anything with the mouth. They think, "Oh, mister, I'm a medical doctor." So they don't realize I'm a doctor, but specialized in the mouth. So it's
so the next time I'm on a flight, let's say we're together, and there's an emergency button that said any doctor on the flight, should I volunteer you?
Funny enough that you asked that. So my honeymoon, coming back with my wife, we were flying back. We weren't in Amsterdam, but we were flying through Amsterdam, and ding, 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 someone called. And I remember I wanted to be all brave and do it. And somehow they did. There was a medical doctor on board that came in and did. But I remember hearing he wasn't quite doing the right thing. And somehow I was the one that got roped into having to stay awake for 12 hours to watch the patient. And I'm the one telling the stewardess, "Hey, can you get this and this?" So, and I remember the doctor in the front goes, "Well, that's impressive. You know that stuff." I'm like,
thank you for being a doctor.
Exactly.
And showing up and taking care of doing a good cause.
Yeah, absolutely. I understand how the body works. I understand in that respect. So
fantastic.
Yeah, I think I'm somewhat qualified.
Viewers, you heard it, and your time is up for your trivia question. So I'll let the doctor answer that question. So how often should one brush their teeth daily?
All right. So we just want to live by a simple rule. 2 times, once in the morning, once at night. I would suggest in certain circumstances to add to that. In other words,
so minimum twice.
Minimum twice when you wake up and go to bed.
Okay.
The most important time is right before you go to sleep, believe it or not. Some people think if I'm going to brush once, I'm going to brush in the morning. Right. It drives me crazy. Nighttime is the most important. But if you're wearing braces, or if you have prosthetic devices in your mouth, or if you have underlying medical conditions, sometimes you have to do a little bit more home hygiene, whether it's brushing an additional once, twice a day, whether it's using some mouthwashes, rinses, whether it's using flossers, picks, things like that. At minimum 2 times. However, on the flip side is you can brush too many times a day, believe it or not. I don't want you getting any higher than 3 or 4. That will start to create irritation. It will start to create problems where you don't necessarily have problems before. You will create problems.
I'm sure some people might not be in the mindset like the more I brush, the whiter my teeth will get.
Absolutely. And that has
cleaner.
Absolutely. That's by no means the situation. Twice a day is all you need. Brush them once in the morning, once at night. It's not that complicated.
Love it. And the hot topic, flossing. Should we floss before or after we brush our teeth?
And that's a hot topic. That's a very hot topic. Now, remember what I do. I specifically deal with children.
Correct.
I deal with children between the ages of anywhere as young as a few weeks.
So he's
old.
A pediatrician. Are you
I'm actually a general dentist to pediatrics.
Okay.
Is what I am. I'm a general dentist limited to pediatrics. Yeah. So
through that word.
I want to make that clear that I don't have a certificate in pediatrics. I did not go for the extra special residency in that, but I've been doing children only. for going on 11 years. So I feel very knowledgeable in that respect. But by no means, for those lawyers out there, I'm not calling myself a pediatric dentist. I'm a general dentist. But with that said, so I deal with kids from a few weeks old up to about 21 years old.
Right.
And with the population that I see, I am happy if they floss, period. I don't care if it's before or after. I just want them to floss. My personal view is, as long as you're getting that floss string between the teeth and getting it cleaned out, I'm happy. Now, the proper way, believe it or not, I think is right before you brush. You want to floss that, dislodge all that material in between those teeth, then go ahead and brush it all out. That's the proper way.
So Dr. Herman recommended before. My entire life, I've been doing it after.
And believe it or not,
I feel better after than
of course,
before.
You feel better. But think about it, if you're brushing, then you're flossing, you're dislodging food, you want to really get those bristles and the toothpaste to get in there and then flush the rest of that out. At the end of the day, like I said,
as long as you floss.
Something my grandfather used to say is brush and floss the ones you want to keep. Simple as that. Take care of it.
And you recommend the same for floss, twice a day or
generally
once?
Yes. Generally, yeah. Now remember, again, specifically what I do with children is a little different. So depending on the age, the young ones, let's be honest, they're not flossing every day. They're not brushing every day. So I'm happy for them to at least get it a few times a week. The way I try to explain to parents is, try to get that floss once a day, if not once, 2 times a week. Build up the confidence, build it up and make it a habit. Just like anything, if you do something enough, it becomes a habit. So if you try someone right now who's never flossed, floss 7 days a week, twice a day, that's 14 times, it's not going to happen. Try flossing once or twice a week. Hey, I can do that. That's not too hard. All right. Now let's try doing it an extra day a week and an extra day. And then before you know it, you build some confidence, you create a habit, and it happens a lot easier.
Love it. And there's lots of products on the market, floss and toothpaste. And for floss, any particular, as long as...
Again, so not to complicate things, but
Right.
there's a million different flosses on the market.
Yes.
It depends on your specific situation. With what I do, good old-fashioned floss. Excuse me for a second, guys. Just good old-fashioned floss. Everyone's seen this little container. You pull the string out, wrap it around, and get it in between. Now they also make floss threaders for braces in specific, and they also make flossers that makes it really special needs patients and kids. I don't care if it's an animal, a dinosaur, a little floss with the plastic, and it helps get in between.
Some people
the teeth
prefer
a little bit
these.
easier.
I'm old school. I prefer the string. Where
And absolutely, and it helps. Nowadays, they actually have certain manufacturers have come out with what they call water flossers. It basically shoots a quick blast of air between the teeth. And studies have shown that it works quite well. So, if you have certain prosthetics in your mouth, they make floss that's a little bit thinner. They make floss that's a little bit thicker. So that's it. Just depends on your situation. Honestly, get that little string that the dentist gives you. As far as toothpaste,
yes. What's the most important thing about toothpaste? Because there's so many burns, different type. One makes you extra fresh, or make you teeth whiter. That one makes you tingling, whatever.
A lot of that aspect is definitely flavor, minty, and different things they put. The biggest thing I look into toothpaste is I want to make sure that there is fluoride in there. Recently, they've made a switch from sodium fluoride to stannous fluoride. Stannous fluoride is a different formulation that they have to use a lot less concentration of fluoride. People are always nervous about that. It's completely safe. But the less concentration, you're using less fluoride. And what the fluoride does is it helps get absorbed into the enamel of the teeth. It actually makes the structure of the tooth a lot more resistant to bacteria. It makes it more resistant to acid. And it makes the tooth slippery, if you will. So anything just slides and slips right off. So anything, obviously, with fluoride, you flip the box over, it'll say stannous fluoride, sodium fluoride.
Any toothpaste has more fluoride, like a 2% minimum?
Absolutely. So it generally speaking, most of the toothpaste you buy on the market, over the counter, if you will, they have all this fancy claims. It's generally all plus or minus within a certain measurement, if you will. However, there are toothpaste that I can prescribe through a pharmacy that have a lot higher concentration. Specific situations call for that.
Okay.
I don't want to give that to everyone because too much fluoride, believe it or not, is a bad thing. And so in certain cases, I need to do that. But for the average person, if you're brushing every day, flossing every day, any run-of-the-mill toothpaste helps. I'm not a fan of charcoal toothpaste, and the reason why is because there's no fluoride in it. However, Crest, wink, wink, just recently, I believe, came out with fluoride. They're pretty smart at doing what they do. You know, they have different
Right.
toothpaste that have
I
different.
wasn't aware of that. 'Cause
Yeah.
coming from the Caribbean, my grandma and everybody else, daytime, they use a piece of charcoal in a cloth or sugar cane, and they brush old school.
Absolutely,
Yeah.
sugar cane.
Yeah, so the sugar cane becomes like a brush, a head of a brush.
Isn't that counterintuitive? All that sugar
Yeah,
content.
but after it's gone, it's just
So what
the
they're doing,
husk.
so what you're doing effectively there is just using it as a mechanical abrasive, if you will, to get some plaque and tartar off your teeth in that
Yeah.
respect.
Yeah.
You know, a lot of I find personally, this is my personal opinion, when it comes to toothpaste, is it's a lot of it is marketing. You know, the fancier
Right.
they make the box, the cooler it is. And that's going to grab your eye. Obviously, different variations are if you have more of a gum issue. They make toothpaste.
I was about to ask you
specifically
that.
for
Like some, like if you have very sensitive
Absolutely.
gums, these
For
are
instance, Sensodyne toothpaste is
Okay.
a wonderful toothpaste. They have a specific ingredient that helps. Simply enough, it clogs the microscopic pores in the enamel that helps prevent sensitivity. And it's a wonderful toothpaste, helps really, and it does really good. Obviously, the big thing everyone always asks about is bleaching and whitening.
correct.
Bleaching toothpaste works. There's a different level of.
How's your smile? Is it white? Do you bleach?
I could probably do it a little bit, but you know, it depends on the ingredient. There's different ingredients as far as bleaching is concerned, but always remember, there's pros and cons to everything. At the end of the day, as long as you're brushing any fluoride toothpaste, you're flossing, that's probably all you need. If a dental professional says something, you know, then we'll go on from there. The last thing I'll touch base with real quick is mouthwash. I'm a huge fan of
We're
mouthwash.
gonna add something else to that.
Go ahead.
Go ahead with mouthwash.
There's so many different types. Obviously, I have prescription strength stuff I can send to you. Again, the population that I see kids, the most common mouthwash I purchase every single day is Act. It's a fluoride mouthwash. It helps, again, refresh the mouth, and it also has that extra fluoride content, number one. Number two, Listerine. Love the stuff. Listerine, believe it or not, is essential oils, is where originally it was founded from. So it's actually quite good for the mouth. There's no chemicals in there like people get nervous and scared about.
All right.
Listerine is great specifically for patients who have gum disease or just want a nice, fresher breath.
So Act is your favorite.
Depending on the circumstance,
Okay,
if it's
so-
a high, what we call cavity or caries risk
Right.
patient, Act. If it's someone who's taking good care and just wants to freshen their breath, make sure there's a lot more, less likelihood of a plaque and stuff like that, Listerine. Can't go wrong.
And same thing twice a day after you brush. Once.
Yeah, you know, I've always personally done it at nighttime,
Okay.
just right before bed. It's just a little extra barrier, a little extra protection, I think is fine.
And I said that we would add one more thing to that topic: the type of toothbrush. So soft, hard, medium, electric, and so there's so much things in the market.
Prince, this 30-minute interview could be 45 minutes and just toothpaste alone, toothbrush alone. So my quick sense as far as that goes. I personally use an electric toothbrush. I love it. I use the Philips Sonicare, have ever since dental school. I love it. Turned my wife on it. Turned a lot of friends and family onto it.
I use electric also.
So traditionally, like you mentioned, they do make traditional manual toothbrushes in different bristles. I don't know why they make them in anything but soft these days. Too hard of a bristle will actually destroy or cause harm to your gums, and it will actually create microscopic scratches on the teeth, which can then
You heard that? Be careful.
promote.
Not too hard.
Absolutely. Not only is it with the soft, always a soft bristle toothbrush, always a soft. I remember growing up, my dad, we would go to summer camp and we would have to pick, we go shopping for all our stuff. When it came time to toothbrush, I'd be looking at all these toothbrushes. You go, son, I don't care what you pick. Make sure it says soft, always soft. There's no need for hard, medium, any other bristles. Now, the reason I like electric toothbrushes, particularly because it does not let you brush too hard. If you start pushing too hard, it vibrates, it lights up, and it notifies you, hey, I'm brushing too hard, you're causing destruction. Always soft bristles. And the other thing is the electric toothbrush does most of the work for you. And honestly, I feel personally like it cleans my teeth better, and studies and research have shown that it actually does also.
There you have it, on the tools that necessary to keep a clean, healthy mouth.
Pretty simple.
Love it. Thanks for sharing that.
Pretty simple.
So you deal with kids
Yep.
compared to adults. Was that by choice, or how do you like? Do you
Absolutely.
love it? You would if you had a choice, would you go to adults or you stick to kids?
Absolutely. So it's interesting that you say that's a great question. In dental school, being around dentistry my whole entire life, there's so many different facets of dentistry. Obviously, you have senior citizens, you have children,
Yes.
you have middle-aged adults, you have surgery, you have root canals, you have gum surgery, and so I knew about that all growing up. And in my mind, I always told myself, "Self, I wanted to do root canals, something called an endodontist." I got to dental school and I go, "I do not want to do endodontics. I hated it. Absolutely not." I never envisioned myself dealing with kids. Now, it helps that my stepmom and dad are both obviously general dentists limited to pediatrics. They do what we do. And so I've been around it. And
Right.
so I had exposure with adults, and I love dealing with senior citizens. On the other side of the spectrum, I love dealing with the children. And after doing kids for so long, I can't ever see myself doing anything different. It's so much more rewarding. Now, with that said, there is a lot of stress associated with working with kids. Absolutely. But I find that kids, I feel like I have a bigger impact on his or her life at a younger age than, the dentist who sees, Mrs. Jones, who's 65. She's probably seen a handful of dentists where
Right.
a lot of my patients, I'm the first person they've ever seen. So I feel a lot more responsibility and take pride in trying to educate that child into hopefully having a great dental life, if you will.
That's a great sharing the mindset of why you love being with kids because you set the tone for the life, for the future.
Absolutely, absolutely, it's key. And the other thing working with kids is it's a different aspect. You can be a kid yourself. You don't have to be very rigid with the suit and tie.
Right.
As you see, I wear a little, caps and different things like that. With kids, you can chat with them about the latest trends, fashion,
And they're so
food,
innocent and
music, exactly. And you're able to have a greater impact, if you will. Adults, all they care about these days is how much is it going to cost? Oh my God. And I never want that to dictate what I do with kids. Now, luckily, a lot of what we do is Medicaid or government
Right.
assisted, and I appreciate it. I love the fact that I get to deal with people who are in need. And guess what? There's very little of any dollars and cents, and I never let money get involved with doing what I need to do to provide the best care that I can. Versus adults, a lot of the times in the limited experience with adults I would say, Mrs. X, Mrs. Y, you need this and this. And she go, how much does it cost? I can't do it. With kids, and I find that obviously parents are always going to do whatever they possibly can for their kids over themselves. They're going to prioritize, junior, and and it's honestly, obviously, this is a business and I make a good living, but I want to provide the best care that I can, and I want to help the child, or the best that I can any way that I can.
Now you spoke of all the things you love about the kids. What about one thing that challenging with the kids?
First and foremost, the biggest thing that comes to mind is obviously behavior, and attitude, behavior. It's the mental aspect. A lot of what we do, people are so ingrained in their head. The dentist, it's so scary, shots and needles and pulling teeth. And going back to what we talked about, if you take care of your teeth, we don't have to do any of that scary stuff. But a lot of what we do is educating that just because we have to fill a cavity or we have to do a certain procedure on a tooth, it is not a bad thing. And I tell them, this is not a painful thing. And a lot of that is, I find that, in this day and age with social media, with brothers and sisters, oh, it's going to hurt. Or grandma, grandpa had. When I was young, the doctor stood on my chest and yanked the tooth out. And that's not like what it is. And I try to make it as comfortable as I can. But as Mr. Prince said, behavior is the biggest thing. Where it's fear, it's scared, it's nerves, and that sometimes if you've ever done anything in your life where you're so scared, your body locks up, and that's probably the most tricky thing.
I'm surprised because you think with so much technology and advancement that you think like it's a good place to come to fix.
Absolutely. However, with that said, you mentioned too much technology. Too much technology is sometimes a bad thing. When I have a 4-year-old young man in the chair, a 5-year-old young man, and they say, oh, well, I saw this on YouTube, and it makes me cringe because sometimes as a dentist, I can appreciate what I'm watching on YouTube or appreciate what I'm watching, and I understand. But a young man, a young lady doesn't necessarily understand, and they just see blood or they see sharp instruments. They get all scared and nervous. But I think a lot of what the kid is, it comes down to explaining properly what needs to be done, explaining to the parents, having everyone on board. There's certain techniques that we have, and there's certain things that we can do to mitigate and help with the fear and the nerves. But you'd be surprised. A lot of times, most kids, if you just give them the time, you explain properly, it works out quite fine.
Love it. Has the dental world changed over the past few years from when you graduated to now?
Absolutely.
Or, in terms of technology, in terms of methods? Is it better? Is it more efficient? So then things that took you 2 hours now takes you 10 minutes?
Absolutely.
Example?
Absolutely. The dental field is changing light speed. It's absolutely astonishing how fast it's changing. The number one biggest thing I find that is everything is going to digital, whether it's digital x-rays, whether it's to digital impressions or digital molds. Gone are the days that where you have to take that gloopy stuff and molds of your mouth. Everything's digital. It's digital cameras and all fancy things like that. Some of our tools nowadays, we can take a digital scan of your mouth and the computer will say, "Oh, Dr. Lyle, you have a cavity here, 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 and here."
Wow, I didn't know.
Yeah, it's changing, and every day the technology is changing. We actually have some technology in the office. It's in the back room where we use lasers too, and we can actually drill a cavity or laser a cavity without even having to use a drill. Nothing even touches your tooth. So we've come a far way, and it changes exponentially on a daily basis. Things are changing. It's crazy. Now, again, remember, well, a lot of what I do with children is very different.
Right.
But there's a lot of new medicaments or techniques, if you will, that are changing. Now, with that said, there's a lot of, I call it old school things that are tried and true. They work the best way. And sometimes it calls for me to use the old fashioned way. But again, I take every situation for what it is,
Right.
and I think it through, and we go based on that.
Because every situation scenario is different for everybody.
Absolutely, every situation is different. Whether it be the size of a particular cavity, the location of a cavity. If it's small enough, hey, we have some really cool different fluorides we can paint on the teeth. I have some other cool medications that I can paint on the teeth, and research has shown that it will actually stop the advancement of the cavity. And the body can actually heal it. Or again, if we have to drill, we can drill. But remember, I have that fancy laser that I can just shine some light on your teeth, blast away the cavity, and it's gone. So we've come a far way. But again, dentistry's tried and true. The drill, use it every day. And that's what most people are scared about. And the thing is with the drill is nowadays we have electric hand pieces. So we don't hear that high-speed sound. So things are changing. And a lot of it is geared towards making it more of a comfortable, better experience. Yeah.
Love it.
Yeah.
And in dental school, what was your most fun experience being a dentist? Was it the theory or the practical?
Oh my God, hands down the practical. I remember in dental school, we could not wait to get out of that dang classroom to get our hands dirty. Now, luckily, where I went to school, a major draw for me was that they got your hands dirty pretty fast.
And that's in Ohio, correct?
Yeah, Cleveland, Ohio. Case Western Reserve University.
School is still there, still thriving.
Yeah, not only is it there and thriving, the location that I went to recently closed, and they built a brand new dental school, high-tech, ultra-modern. It's gorgeous, by the way. And it's now next to the world-renowned Cleveland Clinic in downtown Cleveland. So it's some of the greatest place for healthcare in the world.
Wow.
And so again, back to what I was saying, first year, where most dental schools, you're in the books 24/7. They got us out pretty quickly, going out to local public schools and doing basic cleanings on kids, doing basic examinations. You hands-on. And that's when you really start going, well, I love working with my hands. I like putting what we learned in the book to actual practical use. So yeah, that's the greatest. Now, I have a bunch of stories, not for videos that we can go over, but
I can't wait to hear them.
Oh man,
some juicy stories.
Oh boy. Every dentist has their dental school memories.
If you're a dentist and you're watching this, you can write, comment. We'll be happy to hear your story also. So you're a Buckeye, or since you're in Ohio, you went to college in Ohio. Should I say go Buckeyes or
I might as well end this interview right now.
just kidding? Just kidding.
Go blue, guys.
All right, Michigan. Okay.
Those are some fighting words right
Nah,
there.
I know he's Michigan, but I have to make it juicy.
Oh boy.
All right, you got to change something in the world in terms of dental world. What would that be? You have the power to change or fix or in the world when it comes to dental, because there's many things we could fix, there's many things we could want to change, but think of the dental world
That's
from Africa to the US to the Caribbean to Germany to anywhere. Like, what would you try? And
tough question, but honestly, I
that's
think
what
it
the show
comes,
is about, getting the brain.
the simplest answer to that question is access to care. Access to care. It's just being able to see a dentist. You know, we live in a great country, live in the United States. We live in South Florida, where luckily access to care is not an issue, but believe it or not, it is an issue. And it's
Right.
sad to see. We have a lot of children I see all the time, 13, 14 years old, and I'm the first dentist that they've ever seen.
At 13,
At
14.
13, 14 years old. And a lot of it
Wow.
comes down to, finances and money issues, and some obviously socioeconomic status and some family issues, but access to care. You know, every kid, everyone should at least be able to see a dentist. There's too many people that can't. And, there are plenty of missions out there. There are plenty of dentists that give their time to travel to different countries, third world countries around the world,
Right.
and donate dental services.
Have you done that? Not yet.
I had the opportunity in dental school, and unfortunately, I wasn't able to go. I wasn't picked.
Okay.
It was actually a popular thing to do, and it was first come, first serve. And so many kids signed up, and I was just too far down on the list. And that particular visit was to Guatemala in Central America. And from friends that I have in dental school that went, they said it was the most amazing experience. They still do it all over the world, into the Middle East, into Africa. So
You know what? We're gonna make something happen. St. Lucia, you're gonna see Dr. Herman. We'll make it happen.
we could possibly make something there happen.
Ding ding just happen.
We can make it happen. Absolutely. That is a great idea. I can put
Definitely.
together a little team.
Marvelous Motivations and the Ministry of Health of St. Lucia. We come in for Dr. Herman.
I love it. I'm happy we can put something together. And it's not about necessarily getting dirty in the mouth,
Correct.
drills and things. Honestly,
Definitely.
especially, and going back to why I love the kids. If you see these 2, 3, 4, 5, 6-year-olds just getting in the mouth and saying, here, guys, this is a toothbrush. This is how we do it. Let's educate. If we can educate, we empower for the rest of their life. And it's that simple. If we can get it before decay or disease process starts, you change that life forever. So access to care, I think, is the biggest thing.
Fantastic. We about running out of time. Dr. Herman has been a brilliant, brilliant educator on the show. Thank you for sharing.
You're right.
But before we end it, any last words for any young person out there who would like to become a dentist, or because you shared ways to prevent, and
Yeah,
you just shared
absolutely.
ways to prevent. Because when we get older, we get more problems.
Always.
And you just shared ways to
Yeah.
prevent that.
Absolutely.
We won't stop it, but we can help prevent it or reduce, like root canals and cavities by
Yeah.
brushing twice a day. We're gonna recap
Proper
what we spoke
hygiene.
about. So proper hygiene, brushing twice a day,
Absolutely.
morning, especially at night.
Yeah,
not
absolutely.
right
And
before bed. Not
again, I can
brush your
elaborate,
teeth
but
when
I
you
don't
eat.
want to get into that much detail.
right, and floss. So these are very important, and that'll help prevent, not stop it, but reduce.
Exactly. Prevention is, and I'm sure you've heard it in every aspect of life, prevention is the key to everything. Think about it. You change the oil on your car before the engine breaks down.
Yes.
You help keep it
Maintenance.
maintenance, prevention, exactly. Same thing with the body. You prevent cardiothoracic issues by eating right, working out. It's just like in the same thing with the mouth. If you
Fantastic.
eat right, you limit sugar intake, you limit soda intake, a lot of water, limit the sugar intake. What I mean by that is, a little bit is okay. I'd rather you eat a pound of sugar now than graze throughout the day, because you're able to wash and rinse and brush all that sugar bugs out of your mouth and that helps. But the biggest thing is like I said, prevention. Take care of it. It's not complicated. We live in a society today where everyone's being bombarded with eating this and eating that. And there's so much sugar and bad stuff in there that's influence. So eat a nice healthy diet. Take care of yourself. See a dentist twice a year, and that's it. It's not that hard.
Thank you. But I want you to say a few words for any inspiring young person or adults. Because nowadays you can still go to school no matter how old you are and still become a dentist.
I had in my dental class, I graduated with 66, and there was I want to say young man, but he wasn't. He graduated at the ripe old age of 67. Got tired of being an engineer and went back to dental school.
You heard that. So it's never too late to become a dentist or...
Absolutely. Work hard. You got to keep your mind into it. There's a lot of sacrifice associated with it. When you're in school and your friends are out having fun and partying and doing what they do, you're at home, you're in the dorm, you're in the library studying. There's a lot of sacrifice. Keep your mind straight. If you want it, you can do it. You just got to keep your mind straight. Listen, I got through it.
You can do it. If you want it, you can do it. Ladies, gentlemen, viewers, thank you for vibing. Kids who's watching, please brush your teeth. Thank you for vibing with Mr. Marvelous. Dr. Herman, thanks for being in the show.
My pleasure.
Really appreciate it.
My pleasure. If anyone has any questions, contact Mr. Prince here, and I'm happy to elaborate, go over anything in particular.